Please be advised, this video contains graphic surgical content, including scenes of bloody gums during the surgery. Viewer discretion is advised.
Starting with anesthesia and removing the bridge from the hopeless teeth. The surgeon will begin to open the flap very carefully and cut the pantic from tooth number 5. Then flap is opened gently in order to access the bone tissue. This step is done delicately. In the next step, without damaging the bone tissue, the tooth is removed atraumatically. After extensive washing and curettage, remove periapical lesion along the tooth. The tooth socket was cleaned and curettage was performed using rotary and hand tools. The next stage of piezo surgery acts as designed for open sinus lift or sinus elevation in the area of the tooth number 5. Now we see the same part of the window. The sinus is elevated to create space for the implant. The next step is implant drilling. It is done in compliance with the protocol, preparing the implant location. In the next step, bone powder is placed. The fixture should be placed in the ideal position as carefully as possible. After placing the bone material, the fixture is placed inside the jawbone, and it can be checked with a machine torque as well as with a manual torque. The screw cover is closed manually. After that, the linking steps are completed manually. Bone material is placed in the area of tooth number 7 to preserve the tooth socket. At this stage, the surgeon takes an X-ray of the surgical site, prepares to make sure everything is correct. Then, we compact the allograft material around the sinus, making sure that the material is completely fill up both the sinus window and the tooth socket. At this stage, the flap is returned to its place under tension using 5.0 nylon thread. Here the location of the biograft is shown. The surgeon makes sure of the placement of the allograft material and fixture by taking an X-ray. Preservation of the socket of tooth number 7 has been done well, and the fixture of tooth number 6 has also been placed in a suitable and ideal place.